there are a few problems with comparisons, but I think for a lot of people in a wider audience would still do that. So the question is this: monkeypox versus new COVID mutations, what worries you more and what is potentially more dangerous?
Again, it's too early to try to speculate on what's going to happen with this monkeypox. Monkeypox is a different virus. It's not going to be mutating at the same rate as COVID. So it's unlikely that we're going to see the kind of rapid changes and the variants we saw with COVID. Of course, COVID also spreads through the airborne route, and therefore it was much easier for it to become a pandemic. Monkeypox, the one good thing about it is that it's easy to diagnose in the sense that the symptoms are very clear and obvious. And so public health measures should be much more effective. We need to track and surveillance and do the same kind of things we did for COVID, the sequencing, the sharing of the genetic sequence data, so that scientists can also start tracking. For example, we know this is the West African clade that seems to be spreading here. But when did it actually arrive in Europe? How long has it been transmitting, undetected? And are there further changes as it is spreading through the world?
Sure.
Again, we need this global sharing of data, but at the moment, we should prevent it from becoming a pandemic because we've got it relatively early. And we know what measures, we have the tools. Basically, it's the public health measures, the contact tracing, the isolation, continue to wear a mask and wash hands, etc., and isolate if you're sick.
Right.
And with that, we should be able to break these chains of transmission.